Kenneth, thank you very much for spending our time to share with us. So maybe first of all, you introduce yourself, work, and also yourself, and also your current research work.
My name is Kenneth Fung, and I'm a psychiatrist, staff psychiatrist from Toronto. I'm also a professor with the Department of Psychiatry, University of Toronto. My special area of interest is in culture and mental health, cultural psychiatry, as well as psychotherapy, especially acceptance and commitment therapy. I'm also the clinical director of the Asian Initiative in Mental Health Program at the Toronto Western Hospital. And I've been active in the ACBS ACT community for some years, and the past president for the Society for the Study of Psychiatry and Culture. And I think in the context of this project, I'm also honored to be a consultant on the project, which I'm very proud of because it's such an amazing initiative that it's going to bring so much help for parents and caregivers of children and individuals on the autistic spectrum disorder, ASD. Myself, I'm also speaking from the point of view, in part as a father of an 18-year-old son with autism spectrum disorder, and also ADHD, attention and hyperactive ADHD, attention deficit and hyperactive disorder.
And yes, I have been witnessing like Kenneth has really spent a huge effort in like pushing the entire community, particularly Asian community, in doing all the CBS and all this research stuff. So I just wonder, how did you see the merits or the efficacy of acceptance and commitment therapy, particularly in supporting parents or family caregivers? So what is currently your experience, or what was the past experience?
Sure. I think over the last over 10 years or so, I've been running in the community in Toronto, Canada, ACT groups to support parents and caregivers, including siblings of children with ASD, autistic spectrum disorder. And from the very first workshop, within the first 10 minutes, I was touched by the response of the caregivers and parents, and knowing that ACT is the appropriate model for this. Perhaps I can first talk about what it's like to be caregivers of children with autism. Time and again, people who have taken the workshop comment that there's many emerging interventions that target children with ASD, supporting their development, supporting language development, behaviors, and all of this. But very little actually focus on supporting parents and their stress. I think any parents know the stress of being a parent, that you're constantly focusing on the children. I think this is greatly magnified for parents with children with ASD, especially now the parents of children with ASD have the extra burden of being the at-home 24/7 therapists. Often expected to receive training to do various interventions or behavioral interventions and applying them at home. While this is in some ways a great advancement to help children, it also places a lot of burden, I think, on the parents. So the parents, not only do they have to contend with regular parenting, but also parenting a child with special needs, but now they also have the higher bar of trying to be the therapist 24/7. And I think that a lot of parents and caregivers that I hear struggle with all kinds of different emotions that are not addressed. Everything from anxiety about the future, what happens if I die? This is a common question or common concern that lots of caregivers and parents have. Just even of children, we always worry about the future for the children, but maybe more so when your child has special needs. What will happen if I die? So worrying about the future, but also a tremendous amount of anxiety and stress and guilt of various types when you feel like maybe you haven't done your best for your children, maybe you haven't done the supposed therapy or contingency as best as the therapist thought that you could do. So there's a lot of guilt of not measuring up. And there's also the kind of the shame or the stress when your child acts out in public and you feel like, oh, I'm failing as a parent. There's also times when parents might feel guilty for losing their patience and feeling tremendous amount of self-blame for not having the patience of a saint to be around someone with special needs. And so I think a lot of this, and I hear again and again that they feel like there's no room for anything else in their lives, but 24/7 with the focus being on the children. So I think that's to the detriment of parental health. And so in the ACT workshop, the ACT model, I think it comes from a place of non-pathologizing approach and a non-blaming approach that allows caregivers to finally have a place where they can get the support they need from a model where it doesn't blame themselves for coming up short with having negative thoughts and negative feelings, so-called negative, because it's kind of perceived as negative. I think having a space where they can both share their stories with one another, but also having an approach that allows them to have these negative thoughts, self-blame, anger, anxiety, allowing them to be rather than kind of pushing them away. Developing skills, mindfulness skills, which includes focusing more attention to the present rather than always, or having at least a break from worrying about the future. And I think tapping on values, which includes really how they really want to be with their children rather than always thinking about expected outcomes that everyone, including society, has on on you as a successful parent. I think as part of the Asian culture too, families are so close. Parents feel like the child's success is their success and child's failure is their failure. And parents feel so much more. And I think in Asian cultures that they are so intimately tied with their children, their identity. And that even in the community sharing with others, their failures can be a painful experience. So I think all of this, allowing them to get in touch with values about how they really want to be with the children rather than focusing on achievement. And for Asians, achievement can be very important in Asian societies, in the modern Asian society. So I think that's very helpful. And finally, values can be inclusive of taking care of themselves, because so many caregivers and parents feel almost guilty to have anything to do with themselves if they're taking care of themselves. That concept of self-care does not exist much, because for them, there is no room for self-care. So having a workshop that finally allows them to have self-care feels almost self-indulgent in some ways. We almost have to sometimes justify that being able to care for yourself, you're able to care for your children better. Although when you phrase that, it sounds like that's almost not legitimate just to say you take care of yourself, right? So even when you justify it like that, it sounds like the function ultimately is to benefit your child. So I think that this is a space where talking about values, how it's okay to talk about the importance of your child as well as not in place of taking care of yourself, taking care of your partner, taking care of your friends, being part of the community, all of that. I think caregivers are already having to shoulder the burden of just focusing on the child, and also sometimes to fight with everyone else who might not understand. Sometimes they have to be the advocate for their teachers, or for their even fighting with psychologists and social workers who may or may not understand what they're going through. So I think the acceptance and the non-judgmental space, it's one that is needed. So I think that the ACT model and ACT approach is so appropriate for this. And I think from the feedback from what we've gotten over the years is that they finally found that it's not their fault for failing at something, because they're always failing at learning ABA properly or learning this properly. This sense of failure over and over again.
Yes, definitely. Because actually in Hong Kong, we also did lots of studies and research all related to about ACT applications for parents and also the family caregivers as well. And that acceptance, mindfulness, and values piece do give them a space for them to really share their difficulties and thoughts.
It is about a compassionate space,
Exactly.
compassion for yourself, compassion for your child and your child's abilities and challenges, right? To make room for that compassionate space.
Right, and actually our team is now like try to scaling up the entire ACT intervention to make it more reachable and more accessible. And I think, like Kenneth, you may absolutely agree with that. The COVID pandemic do change the context of how we perceive and receive like mental health interventions. So recently there's a lot of discussion regarding how technology could help to in providing ACT interventions, no matter it's interventions or training or make it more accessible. So what are your views about this, integrating these two?
I think accessibility, it's one of the challenges. I think number one, caregivers of individuals with special needs or ASD or neurodivergent individuals already have so many challenges because they don't feel it's legitimate to care for themselves. And also, it is realistically very hard to step away from this 24/7 expected to be caregiver/therapist role. And so anytime when you have any intervention targeting caregivers, I think accessibility, feasibility, time is always like the number one concern, because anything that takes time away from their kind of on-call duties, it's tough. I think any parents know it's hard to find babysitting and childcare, but it's 10 times as hard if you have to find childcare for an individual with special needs, because you cannot just get any babysitter. You cannot just get, you have to have someone who are able to accommodate the special needs, right? So if you have something, the longer the intervention, the higher the risk of dropout, because the more you're going to have this childcare concern. And so many caregivers feel guilty, taking time away and say, okay, now I have my partner have to look after my child, or I have to get, arrange special childcare. So that can be a real challenge. So anything that increases accessibility would be immensely helpful. And I think with the pandemic coming, I think it has made internet or digital healthcare more mainstream for everybody and more okay. I think that includes even for individuals who are at first hesitant of technology. So I think this is the prime time to use technology. I think the technology has also greatly accelerated in the last couple of years, perhaps because of pandemic and all the focus on digital communication. So from our experience, for example, we used to have, before the pandemic, group interventions in person. And as soon as there was a lockdown, we were worried about what would happen to the intervention. Yeah. So we had to pivot to using video conferencing and Zoom. There was a concern at first that this may not be as effective, and I think this is still subjected to empirical studies. But what we heard is it's so needed, that's for sure. Because when we did connect with caregivers, a lot of them were actually desperate, because the pandemic increases stress for everyone, but increases stress level often for caregivers of individuals with ASD. Some of the lots and lots of programs were shut down at the same time. Extra programming shut down. Sometimes schools were shut down. And I was talking to a parent that felt so guilty that other parents, when they heard that they had to work from home plus having children at home, they said, oh, extra time with their children. But for this caregiver, she said, I feel so guilty because I'm a mom, and I say, I'm going to die if I have to be 24/7 with my child at home and not having any help to manage my child. And I felt so guilty for having that thought. What kind of mom am I if I can't stand 24/7 with my child without someone else helping out? And she felt so guilty about it. So during the pandemic, it really escalated the stress. I have another parent who cannot visit the child because of the pandemic and lockdown, and the child is in an institution. So there are many, many barriers that suddenly arose. I think that the main education or healthcare system, they already are unprepared to help the children. And then for those with special needs, this is extra unprepared without thinking through what are the needs of those. So having like a video conferencing, never mind, is it better than in person or not? But it's a lifeline for a lot of caregivers to have digital kind of options. And we were able to reach caregivers that then didn't need to travel and that can still be at home and have this intervention. So I think that there are, we probably don't know which one is the most effective, but in fact, I think any approach that increases accessibility would be so important. Having an app, having digital intervention, allowing people to take the first step to consider their own well-being would be such an important piece of the puzzle as we are looking for a way to really support caregivers who are in need. It's only a drop in a bucket or in an ocean in a way with all the overwhelming stress 24/7, but at least we're starting somewhere. And I think that this app, this project has so much potential. I think for caregivers who are either unsure if they need help themselves, because the focus is always, how can I learn something to help my children? That's always been the trained focus. But this allowed them to have a low stakes, maybe I can try this app, right? So it's low stakes. So I think this allows them at least a beginning entry into considering themselves. And having I think this project is such a frontier of technology in terms of using the latest technology, latest AI, to allow parents to really use their own language. Feel free to express themselves without the risk of someone judging them. Why are you feeling this way? Why are you feeling stressed? You are a parent, right? So without those kind of concerns, being able to really express how you feel, and then through technology, being guided towards what they may be needing the most. We're not saying this was going to cure everything, but this opens the door. And taking the first step can be the most important towards empowering yourself as a parent. In a situation where caregivers are often made time and time again to feel powerless. When you're facing a child and your child is having a meltdown and you're supposedly best techniques are not working, what do? You feel completely powerless. And when you're made to feel powerless over and over again and having, not much room to verbalize those concerns, or when you verbalize to your therapist and your therapist give you, oh, you should have done A, B, and C. That might have worked. Oh, maybe you forgot this part, right? So I think that this is a space for you to non-judgmentally able to privately test out something and see if you can get something out of it. So I think that this is a very important step in our development. So I think this project is such a vital piece as we develop better and better models to support caregivers of individuals with ASD.
Yeah, definitely. So I think, Kenneth, you have shared your wonderful views, and thank you very much for your kind words. And I think hopefully, currently, and actually we are working together. And I think we do share the same values that we would like to promote the ACT research in a more advanced level, but more importantly is how to let more people to know more about ACT and let ACT be embodied in as our philosophy of living. rather than consider this a kind of therapy, a kind of treatment, a kind of a drug or medication. Let's embody this acceptance and commitment is our philosophy of living, so that we could foster a better mental health to the human beings.
Absolutely. I think together we are kind of breaking down all these barriers of shame, barriers of blame and guilt and expectations, and bringing a lot more compassion.
Right.
And ultimately connecting all of us, because at the end of these ACT interventions, I think what people feel are more a sense of openness to others about their issues and getting help. So having AI, having an app doesn't replace human connections. Rather, I think it's helping remove barriers for connection. So we hope that this would be opening the doors for caregivers so they don't feel so isolated and helpless, and feel empowered that they can reach out and realize that they are all heroes already in their own right.
Yeah.
And there's nothing shameful about struggling, about having negative emotions. And in fact, they have all the power they need to help themselves and also to help the child and to help others, and if they spread out the message. So I think this aspect of empowerment, recognizing that they do have so much, and unlocking it, and having them really attain this valued, balanced, satisfying life with meaning and vitality, and this capacity to connect and outreach. It makes life much more meaningful and hopeful.
Yeah, then definitely that is also the pro-social piece that I often highlight in our research. And also I think this project, we are not playing a role to replace the ACT therapist or replace the ACT interventionist, but we wanted to open the door that, hey, come on. There is an opportunity for you that there's a space for you that you could help yourself. And definitely in this current project, and hopefully we have more projects ongoing, and we could further collaborate together to make to contribute to our community.